Hello, everyone, and welcome to the Arthritis Action Podcast. My name is Marc, as always, your host, and today I'm joined by Dr. Cynthia Swarnalatha. Cynthia is a senior researcher in physiotherapy at the University of Oxford, a senior research fellow at the University of Exeter, and also holds a PhD in applied health sciences. Hello, Cynthia.
Hello, Mark.
Cool. So you kindly joined us today to tell us about arthritis in people's hands. And this is definitely a really highly requested one. I know that loads of people have asked, like, can you do one about this, please? So today's the day. We're finally doing it. And I'm really looking forward to hearing what you have to say about it. So, as always, my intros for guests do not do them justice, as they're always very, very brief. So, if you could start off by telling us a little bit more about yourself and your work with arthritis, please.
Yeah, thank you very much. So, hi everyone. I'm a researcher in physiotherapy, and my main area of research is rehabilitation in arthritis affecting the hands. And I'm also involved in applying the treatments that were found to be effective in large clinical studies conducted in the UK, and then putting it into NHS practice. Um, and I was also very much involved in developing an online version of a hand exercise program that has been recommended in the NICE guidelines for people having rheumatoid arthritis and also hand function problems because of rheumatoid arthritis. So that's about me, and I'm part of the rehab team led by Professor Sally Lamb, who's a pioneer in conducting large clinical studies relating to physiotherapy interventions. So that's about me.
Wow, that is a lot of stuff. I'm very impressed. Cool. I suppose, well, let's get into the topic then. So, we'll start off real basic, as I usually like to do. We'll ease in and probably get more complicated as we go on. But what effect can arthritis have on someone's hands?
Um, the effect of arthritis on hands can be quite disabling. So, if I have to cover the features of the two common forms of arthritis affecting the hands, it's rheumatoid arthritis and hand osteoarthritis. So, they do have some features common to both, though they are distinctively different from each other. The main feature is joint pain, and then followed by joint stiffness. So, for example, in rheumatoid arthritis, the joint stiffness it exhibits as a morning stiffness lasting more than half an hour, while in hand OA, the stiffness will be less than 30 minutes. So that's how we differentiate. And there is joint swelling in rheumatoid arthritis as well, and also in hand osteoarthritis there is a bony enlargements happening. And both conditions, they tend to have the weakness of the hand and the finger muscles, leading to reduced grip strength. And the joints that are affected, they tend to have reduced range of movements when you have to move that joints. And both will have difficulties in the routine daily activities. Say, for example, tasks that require fine motor skills and tasks that require some strength to do, for example, gripping objects and carrying bags, etc. And when sometimes the joint damage is becoming severe in rheumatoid arthritis, the swelling and the inflammation, they tend to actually compress the nerves nearby, and that could cause the kind of symptoms like tingling and numbness.
Mm.
Particularly, and that problem is called carpal tunnel syndrome, which is one of the complications of rheumatoid arthritis. So these are the very general features of these two types of arthritis.
Okay. So, I mean, as well as those, I mean, what do you think some of the most common like problems people start to experience are, other than like the initial symptoms? Like, what are some of the biggest problems people have when they have arthritis in their hands?
The biggest problem people with arthritis have in hands is, like, you can put them into two categories. So activities that require fine motor skills in your
Hmm.
daily life, and activities that require some amount of strength in your hand and finger muscles. For example, activities like holding a pen, even holding a pen, holding cutlery, and also just handling money from your purse, dressing up, buttoning your shirt, or zipping up your jacket, and sometimes holding a toothbrush. So that becomes difficult, and even like people complain of having difficulty peeling that you have the seal on the top of milk carton, isn't it? So
Yes. Yeah. That's quite a common one, isn't it?
that's very common one. So you tend to have a variety of challenges in these when doing these kind of things. So imagine a person who's struggling to do these kind of things that we normally do. So the impact of arthritis, it's actually reducing the quality of life and also the ability to do the normal activities that we're supposed to do. And also there are other activities like where you need some strength to do. For example, you have to turn a doorknob, you have to open a water bottle lid,
Mm.
opening a tight jar, like if you have to, so that becomes challenging. Carrying a grocery bag could be quite stressful. And also washing dishes, sometimes reaching out and taking an object overhead. So those kind of things. So yeah, so these are other things that could be quite challenging. And another major problem people tend to have throughout the day is like fatigue. They tend to have that fatigue,
Mm.
which could have a direct impact on their quality of life.
It's amazing, isn't it, with hands? I think that people don't, it's because we're so used to using them constantly. It's only when you've got an injury or something like arthritis creeps in do you realize just how much you use your
Mm.
hands. Like everything you do all day long is using your hands. So fatigue, especially, I imagine, would be a massive issue.
So they have to deal with every single thing, like with care, with caution, or with some struggle. So imagine how it could be in
Mm.
a person's everyday.
It's got to be incredibly frustrating as well, isn't it? To like,
Yeah.
because it's like say from childhood or whenever you'd be using your hands to do things, to not be able to do things in the same way
Mm.
with seemingly such simple tasks as well.
Yeah. But to add to that, I would say like with the thanks to modern medicine, because the rheumatoid arthritis is being diagnosed very early nowadays and they've been
Mm.
treated aggressively, so the amount of damage is now considerably less compared to the years before. And in hand OE, like the pain is still there, the pain and the level of disability is still more or less similar to the rheumatoid arthritis. Um, um, and it differs from person to person, so that's another thing. So people may struggle with a particular thing and some people may find it very easy to do, and some activities will be very quite challenging. So it differs from person to person, and also it differs from how far the disease has progressed in them.
That's always one of the main hallmarks of arthritis, isn't it? So different for everyone. There's never a straight answer. Like if you have this, you've got
Yes,
this, and if you have this, it's this. It can still have so much sort of like nuances within it, can't it?
exactly.
As well as rheumatoid and osteoarthritis, are there any other major types of arthritis or any types that you can think of that have an effect on your hands?
I think the other forms would be gout, so which actually affects the toe joints, but it could also affect the hand joints.
Mm.
But these are not occasionally they do affect the hand joints, and then psoriatic arthritis, which is characterized by skin rashes, a different form of arthritis. So these are the four types of arthritis that could have an impact on hands, but more commonly the rheumatoid arthritis and hand osteoarthritis.
Yeah, definitely. So how is this diagnosed? How do you diagnose arthritis in someone's hand?
Yeah. So people tend to actually have the initial problem of pain and stiffness. So they tend to complain of pain in the hand joints and stiffness and difficulty in doing activities. So that's how they go and speak to a GP or an orthopedician. And they diagnose by a variety of methods. For example, they take a detailed medical history.
Mhm.
They ask about when did it started, and what were the symptoms they noted. They also ask about family history, and whether both hands are affected the same way, because that is an important feature of rheumatoid arthritis. So both hands will be symmetrically involved, while hand osteoarthritis is just affects one of the joints in one side hand. And they also look for other features like fatigue and whether they had any skin rashes to rule out the type of arthritis. So they take a detailed medical history, and they also do a detailed physical examination. They inspect the joint affected, they look for any deformities, or they look for swelling, which is a feature of rheumatoid arthritis, like
Mhm.
a fluffy swelling. And if there is any thick bony enlargements, that could be indicative of osteoarthritis. And they look for the warmth. They palpate the joints and they look for signs like any hot, like kind of warmth over the joint, tenderness, like when you touch it. So people have tend to have pain, And if they see any if they listen to any crackling sounds of the joint, so these could be indicative of arthritic changes happening. And they also do some simple tests, like they measure the grip strength. Uh,
Mhm.
they use a dynamometer to measure the grip strength, and they also check the range of motion of the finger joints to see if it is normal or if it is reduced. So that could again be an indicative. So they put together all these things, and imaging is done, x-rays are done, but it's not something that you have to definitely do to diagnose an arthritis. So if needed, people will be directed to do some blood test to rule out whether it is a rheumatoid arthritis or if it is a gout or a psoriatic arthritis. So gout means like you might end up with the deposition of uric crystals in the joints, causing severe pain.
Mm.
So when you do a blood test, you will be able to differentiate whether it was a gout or a rheumatoid arthritis or psoriatic arthritis. For hand OA, for osteoarthritis, we don't need to depend too much on the imaging. So if a person is 45 years or above, and if the person complains of pain in one of the hand joints after doing an activity, so the pain should be related to after doing an activity.
Right.
So it's not pain at rest, it's pain, activity related pain. And if the person says he doesn't have any stiffness that lasts more than 30 minutes, then these simple criteria could be just enough to say that it could be hand osteoarthritis.
Well, how would they then firm up that diagnosis?
Oh, it's again like it's depending on the symptoms, depending on what the patients say, and they just tick marking of the criteria. So they have these criteria to tick mark.
Okay, so once it meets a certain amount of criteria, then
Yeah,
that's
yeah.
sort of an
You do
official.
have the grades of how far the joint is damaged, but that is done at the later stages once you have the diagnosis. So at diagnosis level, this was just enough, and it's also known that the amount of damage may not be equivalent to the amount of the symptoms or the loss of function. So it doesn't correlate well, actually.
Ah, I do have a follow-up question from something you said there, actually, because I remember I was asked this. Well, actually, I get asked this one quite often, actually. So I'd love to hear your answer on it. This is mostly regarding osteoarthritis, but like if someone has an injury within their hand, like just say they broke their fingers or they broke their hand or something like that, what is the likelihood of developing osteoarthritis from something like that?
There is an increased likelihood of developing osteoarthritis in the later stages, preferably in the probably in the early 40s.
Mm.
So and it's something for any joint. If you have a knee injury, you're at risk of developing osteoarthritis in the later life. If you're not taking proper care of, like if you're getting obese or if you're prone to injuries again and again, so you may end up with the new osteoarthritis, and similarly for the hand osteoarthritis as well. So there are some certain risk factors for for osteoarthritis. For example, being a female, having a genetic disposition, and a previous injury. So those sort of things are some risk factors for OA.
Okay, so what are like some of the things that people should be looking out for? So if they like, if you think, oh, I've got this, this, and this, I should go to a doctor. What are some of the things that people should like the red flags, so to speak? Like if they've got some of these, should they go see a GP?
I think the red flag is mainly the how severe the pain is and how long the pain is. Are they having any stiffness, symptoms of stiffness? That's unusual stiffness. They didn't have it before. And are any activities becoming difficult that they were doing it normally before? So those are the things that you should keep an eye on and see if, like you take a painkiller and then it reduces, or you did something too heavy or too repetitive and then you had the symptoms, but you stopped that activity, then it was okay. So and if you're above 45, I think you should definitely, if you see a persistence of these symptoms, I think it is important that you go and see a medical professional.
Okay, what would your recommendation be for a medical professional? Should it just be their GP, or should they go see a physiotherapist or a rheumatologist? What would you suggest someone do if they think they've got potentially arthritis?
I think in the UK, so this varies across the different regions and also across the local NHS practices as well. So ideally, if you have problems of like pain or stiffness that is getting severe, or it's been there for quite some time and it started interfering with your daily activities, it's better you go and talk to your GP first, and the GP may refer you to the first contact physiotherapist, who will be actually the first point of contact at the GP's office. So in case if you don't have that, the GP may refer you to a musculoskeletal practitioner who again will probably a physiotherapist, and he will be a kind of a contact and because he is specialized in managing musculoskeletal problems like arthritis. So you may either take that route, and in some places in the UK there are services called interface services where you will have specialized therapy clinics and you can go and self-refer yourself.
Okay, great. So there are multiple options at least then.
Multiple
Yeah,
options.
because I know what one complaint, of course, we always hear, and like, probably everyone's well aware, but wait times can be quite high to get some of these appointments. So I guess if you can afford it, there is the private route as well.
Yes, exactly. So the private is like you go direct and get the direct care, and there is no kind of a single standard pathway how to start, like whom to contact first. So from my understanding, it usually starts with GP who will be referring you to the next. Like kind of musculoskeletal and if needed and if you need even specialized advice and therapy, the musculoskeletal practitioner will be referring you to a hand therapist.
Excellent. Oh, I mean, that would be so I say the dream for many, like if they could just get an appointment with a hand therapist, but obviously all depends on your area, doesn't it, and what's available. Thinking of this, what can people do for their hand health in general? So, I mean, obviously this you might have to give me a multi-pronged answer for like osteo or rheumatoids. I assume they'll have some differences to them, but what should people be doing to their hand health?
I think the first important thing is about how to get rid of pain. So the arthritis is a chronic condition, so it is going to be there for you for years, even if you take treatment, therapy, and if you go for therapy sessions. So what I would suggest is like you need to be in a position to self-manage your arthritis symptoms.
Mm,
So that's the utmost important. So you can do it by how to actually find ways to relieve your pain. So you can either do it by giving heat therapy, like kind of you have a heat pad and keep it on the joints that are affected, and or if the joint is swollen, for example, in rheumatoid arthritis, you can give
mm,
cold packs. You wrap it in a towel and give it on and keep it on the affected joint for 10 to 15 minutes, and then do it like intermittently. So that is another way of relieving the swollen area. So mainly the cold is mainly for the any swelling with because of rheumatoid arthritis, and heat is something like when you have pain, so heat actually soothes that out, and then it will your pain will be better manageable, and then you can do the exercises. So pain relief can be done either by heat or cold, or you can take the painkillers, the over the counter painkillers,
mhm.
and see if that helps. And if you've been prescribed with any non-steroidal anti-inflammatory creams or pills, so that is another way of managing pain. But you need to make sure that you're taking at an appropriate dose, and that's been approved by your health professional. So that's important. So you can't just rely on painkillers throughout your life, isn't it? So
Absolutely.
yeah. And then there is also an option of getting steroid injections from specialists. So steroid injections is like mainly for temporary hand pain relief. So they give injections into that affected joint area. So that gives you kind of few weeks of pain relief, which will actually give you some space to carry on with your daily life. And sometimes you may need some repeat injections, and because it's short lived, isn't it? So so the steroid injections is another way to get rid of pain. So heat, cold therapy, painkillers, non-steroidal anti-inflammatory drugs, and or you can creams like you would see the diclofenac cream. So that's also helpful, and the steroid injections are also helpful. And another way of relieving your pain would be using splints
Okay.
or braces, which I'll talk about that in detail in a minute. So that's another way of actually giving support to your affected joints, because it gives support and it stabilizes the joints that are affected. So it relieves some pain and it gives you support.
Okay, good. One thing you did mention in there as well, which I definitely would like to talk more about as well, and don't worry for anyone listening, we will come back to braces and splints because I know some people will want to hear about that one. But I wanted to talk about like exercise for your hands. And because obviously, as part of like especially Arthritis Action, one of our major sort of things is all about self-management, of course, and exercise is always a big part of it for people with arthritis. So I was wondering if you could tell people what type of exercise could they be doing for their hands?
Okay, so After pain relief, I think it's really important. You need to know what exercises you should do for your arthritis.
Mm.
For rheumatoid arthritis, so we do have a very effective treatment called SARA hand exercise program, which is called a stretching and strengthening for rheumatoid arthritis of hand. So this program is actually recommended in the NICE guidelines. So it is a very simple exercises. So you have a set of exercises to improve your mobility of your finger joints as well as your other upper limb joints, and also strength exercises using putty and exercise bands. So, for example, you can do some tendon gliding exercises, just a simple opening and closing of your full fist slowly and bending all your finger joints to the full and then slowly extending. So that actually is a very good exercise. And having a soft ball and then slowly gripping it and releasing it and gripping it and holding it for 2 to 3 counts and releasing it. So that is again a good exercise for strength. And like you can have putty and you can do some individual exercises for each finger by pressing it with your thumb and with your index finger and with your thumb and with your middle finger. So you can use putty to do your exercises. So what I mentioned here is just a kind of a gripping exercises and also making a full bending and extending of your finger joints would be really helpful.
What about there's one thing I've heard some people have said has been really good for their hands is things like playing games and using like PlayStation controllers or whatever console they use. What are your thoughts about that for like dexterity exercise and so on?
So gaming exercises, as far as they don't add too much stress, too much strain to your joints, because you have been doing those gaming activities, they require the constant movements, isn't it? So you need to do
Mm.
it for a considerable amount of time. You can't just stop, isn't it? So if you're playing a game, you have to finish, or if you're doing an activity, like I remember doing a work on involving the computer games and also the objects of daily life. So I have an object of daily life that becomes a mouse, and you play that and you control the movements on screen for on a computer game. So though those are promising approach, my concern would be like how far are they doing that repeatedly. So repetitive
Mm.
movements actually can be a factor that can aggravate arthritis. So gaming exercises, if it is carefully planned and if it is if it is prescribed by a health professional, I think that is something you can explore, but I'm not that sure how far it will work.
I suppose, I mean, yeah, I was just curious. I've had a couple of people ask me and say it's been very beneficial to them. But I suppose exactly as you're saying, the pacing element comes into it as well. So if you're doing it all day long, that could be too much stress for your hands to actually handle,
Mm.
couldn't it?
Mm. Just to add to that, so you asked me about how people could manage arthritis. So what I spoke first was self-management of pain and focusing on pain relief, and then we do exercises. And for exercises for hand osteoarthritis, you can give some exercises for the thumb because thumb is one of the common joints affected by hand osteoarthritis.
Yes, of course.
Yeah, so you'll have some specific hand exercises the therapist could teach you, like touching the tips of your other 4 fingers, and then bending and extending your thumb. So simple exercises that will keep your thumb mobile. So you can do that. So exercise is another core component of how you manage your arthritis hands. And the third thing is about how you can protect your hand joints from further damage. So I can talk about that, how you can do that in detail. So, but the basic concepts is like you need to be aware of the activities that are repetitive, that are high impact, that are too much loading for your finger joints, just to protect your joints. So there are some activities that you should be very well aware, and you should be either avoiding it or you should be doing it very minimum.
Okay. I mean, can you give an example? What type of things would be like considered too much?
Yes, for example, high impact activities like if you have to lift something very heavy, so that is too much strain for you. You're putting too much strain on your already damaged hand joints.
Mm.
And then if you're doing something very forceful gripping, something you have to hold it very tight if you're supposed to do that. So that is you're putting too excess pressure, excess strain. And for example, another example is wringing clothes, like wringing a heavy wet towel
Mm.
with your damaged hands or with your hand osteoarthritis hands. So that is actually going to damage even further, and it sometimes it may even lead to a flare up. flare up, like a severe sudden onset of severe pain. So that is one high impact activities you can avoid. And the other is repetitive movements. For example, you keep on knitting for a long time without taking a break. You keep on typing without taking a break. You keep on gaming without taking a break. So
Yeah.
those could be some kind of risky things you can do. And when you are exercising, you need to be aware that you avoid any full body weight bearing through your hands. For example, when you're doing a plank, it's better you do an elbow plank rather than a hand plank,
Okay.
because you're putting all your body weight on your hand joints. Or like if you're doing push-ups, that again is a difficult exercise. So because you're loading your hands too much there.
Mm.
So it's better you avoid those kind of activities. Sometimes people do some extreme end movements, like you go to the, like if there is a limit for every single joint movement, isn't it? So if you do
Yeah.
something very extreme, go to an end ranges of movements. So that again can make it vulnerable for further damage. And another important thing I want to add here is like you should avoid is like try to be avoiding too cold weather. And if you're going out, or if you're going out in cold water or in a cold weather day, just be sure that you protect your hand joints with warm gloves.
Yeah, that's something we hear a lot about, isn't it? Because people, the cold weather especially, the hot weather also does seem to affect some people. I guess it depends on the person again, but yeah, cold weather, especially in England where we currently are, does happen of every year, of course. So you reckon like gloves and things like that would be an ideal, would they?
Yeah, yeah. So if you have to protect your joints, hand joints, I would say be mindful of if you're doing avoid high impact activities, repetitive activities, any weight bearing activities on hands, and also any extreme stretching.
Okay. Good tips. Good tips. So, as we've mentioned gloves already, I suppose we were going to go back to things like braces and splints and things like that. Can we talk a little bit about those for arthritis in your hands?
Yeah. So gloves, braces, and splints are really helpful for arthritis hands. For example, gloves is like these gloves are actually prescribed for people having mild to moderate levels of arthritis, particularly rheumatoid arthritis. So what these gloves do is like if you put a glove, so that is going to give you, it's going to compress your hands and actually going to help you reduce the swelling.
Mm.
And it's also going to help you keep the hands warm, and it's going to support your hands. So there are three ways it can help you actually for rheumatoid arthritis. So therapists can either prescribe compression gloves, which is mainly to reduce the swelling of the
Hmm.
hand joints, or they can give you some thermal gloves if you have to keep your hands warm and if you're going in a cold weather, or any work related gloves. Like if you're going to involve in a manual task, it's better you have some really good padded gloves so it protects your joints while you're working. So these are the three different gloves you can use for arthritis. And the main purpose is to reduce swelling and also to keep your hands supported and mobile.
Okay. Okay. I mean, how much should people be wearing these though? Because I know so there's always that question as to how much is too much for anything like that.
Yeah. So these gloves, for example, the compression gloves can be like it can be worn like a kind of a fabric. So it's lightweight and it's easy to remove and put. So this is something you can wear it throughout the day, like if you're working, so it still offers support. And sometimes you can wear it for night if it's like if there is swelling, you can wear it for the night as well. But it's a common thing that you don't depend too much on these on gloves and braces because it may weaken your hand joints. So not over rely too much on that, but you can do it when you're working or when you're sleeping.
Yeah, exactly. Yeah, it's one of the things with braces and like any kind of supports, isn't it? You need to make sure you're still using your muscles and they're still
Yeah,
getting worked. It's just
yeah.
maybe the most extreme points. Give them that extra support, like a brace or a glove.
Gloves are manageable, but actually better they can be easily managed than the splints. Because gloves is, as I told you, it is like a fabric. You put it and you can remove. You can
Yeah.
remove multiple times and you can put it. So you don't definitely need to be throughout the day or throughout the night. But for the splints, braces and splints, so you have different types of splints. So we call it as resting splints. So the purpose of splints is either to immobilize or to stabilize. So when you have an injury or when you had a hand surgery, the first few days they immobilize. They don't allow you to move too much. So those are called splints. And if you have braces, and they'll be usually made of rigid material like kind of a thermoplastic, which keeps you very rigid. So it doesn't allow you too much movements because to protect your joints that are just gone for surgery. Or it can be braces, which can be like kind of a simple neoprene, which is easy to remove. And you can, I hope you have seen people having this kind of a brace around their thumb joint and the
Mm.
wrist. It will support the wrist and the thumb when they are working.
Okay.
So it is neoprene. Like, neoprene means like it's a like kind of a man-made rubber, and you have it with Velcro, and it's also easy to remove and put it back. And
Mm.
this is something you can wear it throughout the night, throughout the daytime when you're working, and it will support your joints while you're still working.
Yeah, you can find those in places like Boots or just any kind of sort of like shop or even sports shops as well. Will always have a lot of neoprene braces and sports in
Yeah.
there, won't they?
Resting splints is something when people wear it during the night time. So it just allows you to rest. And if you have a flare up, that is actually going to help you a lot. So you wear it throughout the night because you're not doing any work during like when sleep when you're sleeping, isn't
Mm.
it? So it just maintains that, provides support when you're not doing anything. So that is resting splint. And functional splints or the daytime splints is when you wear the splints that you can use when you're working.
So do they have like they bend with your joints, I assume, but maybe keep it in a straight line? Is that what they do?
So it depends on the type of deformities. So you either have kind of a rigid design for a particular deformity, or it is custom made for each and every person.
Right. That was another question as well I was going to ask about, like, because I know that some places don't, or some people rather, might say don't just buy off the shelf stuff because it won't fit you and it's not
It
made
won't
for
fit.
you. But yeah, so
Yes.
what are your thoughts on that?
Exactly. So it's good. It would be better if you first consult with your therapist and take their advice. Because
Mm.
some therapy units they do the splints on their own. They provide it to their patients. They they actually work on that. They produce that and they give it to the patients, custom made. So that is something doable. And if you're buying it off from shops, it's important that you have to. It is correctly fitted and it's comfortable for you. There is no point if it becomes uncomfortable.
Mm.
And if it doesn't fit you, that's not going to serve the purpose. And you will continue to have joint pain because the purpose is to protect your joint and to support your joint. And that support actually it gives enough rest and it doesn't put too much strain on the joint. So that's how the joint damage, any further damage is prevented.
Excellent. Speaking of like, you mentioned a couple of times about rest, and I would imagine that the hand, right, so I know the hand is basically one of the hardest parts of your body to rest. But as with all types of arthritis, rest and pacing is always really important. So how do people rest their hands?
So there should be a good balance between activity and rest, okay, throughout the day. It's not just for one activity or just for 1 hour. It has to be throughout the day, and you should be conscious about that.
Mm.
For example, if you're going to do if your day is going to be involving a lot of typing work, make sure that you limit your work for the first 20 to 30 minutes and take a break.
Okay.
And if your day is something related to doing a repetitive work, make sure you take a 5 minute break in between, like for a 20-minute work. So the rule is 3:1. So if you're working for 15 to 20 minutes, 5 minutes break.
Mm.
So that's how you think about scheduling your task. And if it's going to be a housework or gardening, make sure that you also make use of the adaptive equipment. So balance between activity and rest plus making use of adaptive equipment would make your day manageable. So you don't have to do all by yourself. Get your adaptive equipment. For example, like you have the spoons with big handles, which is easy to grip.
Mm. Yes.
You don't have to struggle with the fine motor skill. If you have a big handle, it's easy to grip, isn't it?
Yeah.
And if you have a can opener or an adapted can opener, that's easy to open a can rather than struggling.
You can also get electric ones as well if you really do need to
Exactly.
take the complete load off.
Exactly. And even if your kitchen space, make sure you organize that for your convenience. You don't have to have big bottles, storage bottles. It's better you keep the small bottles which are easy to handle for you.
Yeah, there's
So
there's loads of great kitchen adaptations, aren't there? With like
yes,
different sides of
exactly.
One nice tip I remember someone gave me is they struggle like with certain types of bottles with their hands, but whereas some they find much easier to handle. So they
Mm,
made sure they keep any ones of that they get and decant the stuff
yeah,
from the other ones into these other bottles just because it's just easier for them to get in and out of fridges and so on.
yeah, yeah,
Also, for those of you listening, we do have, I believe we've got some stuff about gadgets and like various aids you can use for your
yes,
hands on our website as well. So I'll put a link for that in the episode description below.
yeah.
Actually, is there anything else you wanted to talk about with rest?
Yeah, I can talk about the joint protection techniques, which we
Sure.
usually offer for with the people with arthritis. So the joint protection techniques means a set of principles we tell people to use in order to protect the joints from further damage.
Okay.
So the first is we ask people to use the joints in stable positions, in good positions. So not going at the extremes or not using when if you feel something not convenient for you, don't do that. Don't choose that position. For example, even having that small the kind of stands at the back of your keyboard. And if you keep that and if you work on that, it would be difficult for you. So instead, you keep it flat so when you work at the desk level, your keyboard is at the desk level, and you keep your hands. So that position is good for you.
Oh, is that better than having the little things? Oh, right. Maybe I have to change my hand position on my keyboard then.
Yeah, yeah. So yeah, keeping in the comfortable rest functional positions actually it doesn't cause unnecessary strain on your joints. So look into your joint positions. So don't go to the extremes of movements. So make sure you're working at a good position. So that is the basic thing we tell, and then make remember to respect your pain level. So if you feel something, if you feel some dull ache or a kind of slight pain when you're doing an activity, that's the point you need to stop and take some rest.
Hmm.
So you don't ignore that and keep doing the task and end up with a flare up. So be conscious of your pain limits. So what is your limit of doing an activity? You should be knowing which activity causes which how much level of pain to me. Whether there are any activities that I should be never doing at all, whether I should take help, or whether that is something I can manage. So you need to be aware of that levels. And if there is any signs of pain starting coming, like symptoms starting, just stop it and then take a break and then gradually start doing again. So you don't have to stop it completely. All you need to do is like pace, stop and take a break. And the next thing we would suggest is use your larger joints as much as possible. For example, when you're carrying plates, just don't rely on your finger joints, but also make use of the palm area.
That makes sense.
It distributes the forces, so it doesn't put too much strain on your small hand joints, okay? And another thing is like, if you have to carry a grocery bag, don't lift it with your hand, with your finger joints, but instead you can put it on your shoulder,
Hmm.
or you can put it as a backpack.
Backpacks are an underused thing, especially with like when you have issues with your hands, aren't they? Because it's completely hands free that way, isn't it?
Yes. So, and the other thing is like if you're going to carry some weight, uh, don't just rely rather than putting everything on your hands. Also, distribute the weight on your forearm area.
Hmm.
So that though by that ways you can actually reduce the amount of strain you're putting on the hand joints, and get help and make use of the adaptive equipment. So these are the ways you can actually make the task easy as possible.
Excellent. That's all. That's excellent advice there. Thank you very much. Cool. So I suppose I've got one more thing left to talk with you about, and then I will let you go back to your day, as I'm sure you have plenty more things to be doing. But I mean, the last resort a lot of the time for things like osteoarthritis or any type of arthritis is surgery. So I thought we'd cover that one last. What about sort of surgery within people's hands, and like when will that be needed?
So surgery is definitely an option in hand arthritis, but only a relatively a small proportion of people go to surgery,
Hmm.
and also when all the other conservative treatments fail. So that is the point we actually suggest for surgery. Or if it is going to be a very severe pain that people can't handle at all, if there's any severe deformity like that they're not able to function at all. So those are some specific factors that will actually lead we make a decision to go for surgery. Otherwise, until that point, we tend to keep that conservative as much as possible. Self management, exercise, pain relief, and taking care of your joints. So the majority of the time, these combinations work really well. And only in specific situations we end up with the surgery. And again, that is a collaborative, like it's a decision making with your surgeon and with your health professional team. So they all come together on a common ground, and then they make a decision that this person needs surgery for so and so. But the primary reason is like when other measures didn't work, we end up with surgery.
Yeah.
So what we do in hand arthritis is like we do surgery called a synovectomy. So synovectomy means like you remove the membrane which is lining the joints. So this is one of the particular structure that gets affected because of arthritis. So this gets inflamed and it oozes out a lot of liquid, and that's why you have a swelling around the joint. So in that cases, that lining has to be removed in order to prevent further joint damage. So that is commonly done in rheumatoid arthritis.
Okay.
And joint fusion, like when you have a very unstable joints because of rheumatoid arthritis, they just fuse two joints, and this is particularly done in the little joints near the fingertips. So that is done there. And joint replacement is something done in both rheumatoid arthritis and osteoarthritis. So they replace the joint with an artificial implant. And particularly the OA, it affects at the base of the thumb. So at the basal joint of the thumb. So you have that removed, you have that replaced by a metal implant. And when you have a metal implant, the replacement is done, the function is much better.
That's one you don't hear too much about, because obviously we hear loads about hip surgery or like, knee or something like that. But I don't think even with the job I have, I'm not sure I've met anyone who's had a thumb joint replaced before.
And in UK, they also do a lot of trapeziectomy. So the trapeziectomy is a small bone at the base of the thumb joint. So that will be removed, and they will replace it either they will fill that gap either with a tendon or with some other metal kind of stuff there. So trapeziectomy is a very common procedure done for thumb osteoarthritis.
Wow.
And sometimes if you need like the nerve compression, decompression is done with like when nerves are affected, like when you have these damages compressing the nerves, and that is causing the nervous symptoms, they do this the nerve decompression. And sometimes when tendons are like in rheumatoid arthritis, what happens is like the whole joint gets affected, and then there is a damage to a lot of structures around the joint. And one of the structures affected is the tendons, and the tendons will actually need to be repaired. So these are the variety of surgeries that are done in rheumatoid arthritis and osteoarthritis.
Wow.
And
Oh.
any surgery should be followed by a really like a structured rehabilitation program, follow-up visits, and then taking care of your hands, which will lead to good outcomes.
Excellent. Excellent. I think that's a very nice note to end on as well. Yeah, please do make sure that you do your rehab and do your exercises and look after your hands as well as you can. Amazing. Thank you so much, Cynthia. That's been great. So yeah, if you'd like any more information on the stuff we've been talking about today in this episode, please do have a look in the episode description. We'll have a few links there for you. There's a lot of good stuff on our website that might be quite useful for you. And also, please don't forget to like, follow, subscribe, rate the podcast here, wherever it is you're listening to it. And yeah, if you've got any questions or anything, there's also an email address there, and you can send us any questions or any future topics you'd like to hear. Not hands, we've just done that one, of course. But yeah, Cynthia, thank you so much for your time. That's been really interesting.
Thank you, Marc, and thank you to Arthritis Action Fund.
Thank you. Our pleasure. Thank you, everyone, for listening as well. Okay. Cheers, everybody. Bye-bye.